This is Rayplicker, a spectrophotometer developed by the company Borea. It's really easy to use. Actually, you just need to clip this mouthpiece here, which is a sterilizable mouthpiece. You light on the device just by pressing the switch here, and once it's switched on, just click on shade taking. Ask your patient to open a little bit the mouth, brace with the nose, and you will come with the mouthpiece against the tooth, really against it, and once the tooth is well in the middle of the screen, you can just press the switch for taking the acquisition. The acquisition will be made in less than 1 second, actually in 600 milliseconds, and then you will have a time for treatment. This is the spectral analysis which is being made. So what is really important with this device is to really clip this mouthpiece at the top of the measuring head. And why it is important? Because it will make the focal length between the sensor and the tooth, and as well it will enable the self-calibration of the system, because we have a specific gray inside of the mouthpiece for self-calibration of the device. So after the image treatment, the first image that will appear will be a polarized picture. Why polarized? Because you have some polarized feature just over the lens. So clicking on it, in the second image here, the system will automatically detect, thanks to an algorithm, the tooth border. As you can see here, the tooth border appears in blue, and inside of it you have the overall shade of the tooth. Coming in the third image, you will have the analysis in 3 parts, from the coronal, the middle, and the incisal part of the tooth. This is an average on each areas of the tooth. Coming in the next one, you will have an analysis in 9 areas, having, by comparison, for example, with the blue points corresponding to 1M2, with the green point 1M1, and the yellow point 2L2.5. Then you will have full spectral analysis, giving you pixel by pixel the shades corresponding on each pixel of the tooth. So for example, here the green part will be 1M1, the orange part will be 2M1, the yellow part will be 2L2.5. So this is the most accurate analysis you will have. And if you come again to the overall shades, this overall shade is actually an average of all the shades present on this tooth here. And this analysis, coming in the 3 parts analysis, it's an average on each part of the tooth. And then to finish, you also have an analysis of the translucency from 0 to 100%, and the darker points are the most translucent parts of the tooth. These translucent areas can be also shown directly here in the polarized image. Once you have seen all the mappings, you can write a patient names just by clicking here and writing the name thanks to this keyboard, and also select the referent tooth just by selecting the number. Then clicking on it, you can just save the case, and you can save until 40 shades directly in the device memory before transferring all data to your computer thanks to the docking station.